We are now in the last couple of days of National Children's Dental Health Month, and with that, it is a good time for you parents out there to learn how you can improve your children's oral health. I know I need some help in this department for my little one. So to help with that, we welcome back PHL17, Dr. Mike Koumaras, Pediatric Dentist from Best Dentist for Kids. Dr. Mike, how are you?
Doing well. How are you?
I'm good. Thank you so much for being here. So this is some really important stuff that we have to talk about today. One of the things, I'm really sorry to admit it, but we're having issues getting my daughter off of the bottle. And you say, as soon as you can, try to get them off of bottle feeding. And why is that good for their teeth?
So, taking the bottle at night, especially, just in general, being on the bottle past a year old is not ideal. But almost more importantly than being on the bottle, because it is nutritive, obviously, is what's in the bottle.
Okay.
So having milk in the bottle is very common. Some parents put juice in the bottle. Definitely do not. We do not want any juice in the bottle at all. Juice has no nutritional value. It's basically, I tell my patients, it's like basically just sugar water. So we don't want to be feeding that to our kids.
Yeah, no.
But a good way to try to wean your child off of the bottle is because if they are getting milk in it, you switch to water in the bottle, and all of a sudden that tasty milk or juice doesn't taste so good. It's pretty plain with water. And a lot of kids around a year old, if you make a simple switch like, okay, now all of a sudden there's just only water in here, they're kind of not as interested in taking the bottle.
Okay.
So that's a pretty easy thing that we can try to help.
All right, let's try it. Let's do it. All right, so you also talk about pacifiers as well. Pacifiers and also sucking your thumb. So how is that bad for your teeth, and how can we get kids to stop doing that?
Excellent. So that gets into the non-nutritive sucking habits. So there's not any, they're not getting any nutrition from that. So, but it's a real habit, you know, sucking on your thumb or having a pacifier is really addictive, you know, for kids, and it's very hard to get them off of it. But what happens is our palate, our upper jaw, it's still soft. Right in the middle of the palate, there's still cartilage, just like how babies have cartilage in their head.
Yeah.
There's some in the middle of the palate. So when they're sucking on something non-nutritively like that, they're actually caving in their palate and making it more narrow, opening the bite up and causing jaw structure changes.
Whoa.
That a lot of later down the road, they're going to have its interceptive orthodontics to reshape that jaw with like a palatal expander, which I'm sure you know a lot of people have heard of that. So we really want to wean them off of that. And there's definitely some products that are meant for stopping thumb sucking, that basically it's a nail polish that tastes pretty bad.
Yeah.
But I actually find it works better when you use those products. One of them is called Mavala Stop. You can buy it on Amazon. But when you actually, it's a clear nail polish. You paint that on the pacifier. They think they're getting their normal pacifier, put it in their mouth, and probably cry for the first few times they try it.
I'm sure,
but now they know that next time they go for it, it's like, oh, that tastes really yucky. I don't know if I want that. And they can actually break themselves then.
Okay, good tip there. Okay, you also say when the first tooth arrives, that's when you have to start bringing them to a dentist like you.
Yes, so that's when you want to start brushing. And the most important thing to do is obviously once they get those teeth, start brushing. And only use a tiny little bit of toothpaste, whether it has fluoride or not. Either way, you just want a little bit. But you want to get them in when they're 6 months old to the dentist to go over a lot of these things. And choosing the right dentist, obviously you have some questions, especially first-time parents, that we need to kind of go over those things to get them into good habits early on and to introduce them to an environment at the dental office that isn't scary.
You talked a little bit about this, the type of toothpaste. Does that matter?
So yes and no.
Okay.
The most important part in the process is how good they're brushing. So parents always ask me about toothpaste. So when they're really, really little, you want to minimize how much fluoride they're swallowing. So a safe to swallow toothpaste is great, especially with grandparents are going to put a huge glob on there. They overdo everything for our kids.
Of course.
But for the parents, they could just put a tiny, tiny little dot, no more than a grain of rice if they do use the fluoride. Otherwise, just play it on the safe side. Don't give any fluoride toothpaste till they're starting, you know, a year and a half or so, and they can spit a little bit, or they're just not going to be swallowing everything.
All right, Dr. Koumaras, thank you so much for being here. Really appreciate it. If folks want to learn more about you or your practice, where do they go?
bestdentistforkids.com is our website.
Perfect. Well, thank you so much.
Thank you.